We're very grateful to Senator Harkin for allowing us to use this room and to piggyback upon the media attention and the attention of the health research community as we unveil a new report on the foundations of most of the chronic diseases that now face the United States. And as you heard from Dr. Hodis and many others this morning, we're talking about the fundamental aging process in human beings and how that sets us up for everything from diabetes to cancer to Alzheimer's disease. So I'm pleased to open this up and release this report. My name is Dan Perry, and I'm the president and CEO of the not-for-profit Alliance for Aging Research. And our organization is a 25-year-old national not-for-profit organization that's dedicated to accelerating the pace of medical discoveries to improve the universal human experience of aging itself. So we are here today to release the transformative transformative promise of aging research. And this is a groundbreaking report written by a noted science journalist and writer and author, David Stipp. The report details the social, economic, and political implications of pursuing a well-coordinated and well-funded research initiative to reveal the biological basis of human aging. As you also heard this morning, we've added some 30 years to life expectancy just within the last century. So 100 years ago, most of us didn't have the luxury of old age. And today, life expectancy at birth is almost 80 years. More than that if you're a female, and even more than that if you've already survived to adulthood. But while we've gotten very good at adding life years, we've yet to master how to keep those years as healthy and vigorous as we know they can be. 80% of seniors have at least one major chronic condition, and half have two or more. Chronic diseases at later life are currently costing the nation some $1 trillion a year, a figure that is expected to increase to $6 trillion by the middle of this century. And now that the baby boomers are turning age 65 at the rate of 10,000 a day, and will stay at that level for the next 18 years, by 2030, not that long ahead, when the youngest baby boomer is already 65, one in five Americans will be age 65 or older and eligible for Medicare. In order to avoid the ballooning elder care costs that await us in just the near future, the country has to invest now in prevention and postponement of age-related illness. And currently, the great majority of federal medical research dollars, as you've heard from the testimony this morning, and you know from understanding how the NIH is structured, most of that goes to study the diseases of aging, including cancer, heart ailments, stroke, diabetes, Alzheimer's disease, blindness, and other conditions. But research in these conditions tends to be studied in isolation from the other age-related conditions and largely divorced from the underlying biological processes of aging, which leads to all of them. Less than 1% of the NIH budget goes into understanding the underlying biology of aging and its role in age-related diseases. But the processes of aging are now seen by scientists as the common denominator of virtually every chronic disease that we face. The scientists know that it's alterations in cell replacement and cell repair, stress response, chronic low-level inflammation. These are the key influencers in cancer, heart disease, diabetes, Alzheimer's, and many, many other debilitating and very costly conditions of later life. As a result, advocates and scientific community are beginning to mobilize behind research targeting aging as a modifiable risk factor. And yes, I said modifiable. Research that slows aging has the potential to do what no drug or surgical procedure or behavior modification can possibly do, and that's to add healthy years of life and simultaneously postpone the costly and harmful conditions of old age. Nearly 70 of the world's leading scientists and experts have now endorsed this approach. Today's report, The Transformative Promise of Aging Science, outlines the potential economic and human gains that can come from advances in this research. And the report is just part of a larger campaign coordinated by the Alliance for Aging Research and other not-for-profit groups to press for a widespread consensus on the most promising areas of aging science. Scientists who study aging are in general agreement that the aging process isn't set in stone. It can be sped up by genetics or the environment or poor lifestyle changes, but it can also be slowed down. Our organization and its partnering groups are now promoting the benefits of better coordinated and cross-cutting shared research at the NIH to get at the mechanisms of human aging and its health consequences. And you heard this morning that the NIH has recently announced it is forming an integrated interest group that involves 17 of the major institutes of the NIH to pursue geroscience. This is a new term for understanding our aging bodies so we might experience more healthy years of life. This trans NIH group will enable multiple research institutes to pool expertise and knowledge in order to confront the mammoth health challenge of an aging population. And recognizing that the American public needs to be brought along and to understand, and that thought leaders in media and others also need to understand what the central challenge for the future of an aging population is, we are mobilizing a Healthspan campaign to increase the public's understanding of aging research and its potential to make our lives better. And you can learn more about the Healthspan campaign and view a copy of this report online at www.healthspancampaign, all one word, .org, healthspancampaign.org. We're going to hear from Dr. Brian Kennedy, who is the President and Chief Executive Officer of the Buck Institute for Research in Aging in the San Francisco Bay Area, a global center for international research in aging. And Dr. Kennedy will have some exciting information to impart as well.
Thanks. First of all, I want to thank Dan for inviting me here today. The Alliance for Aging Research has done a lot for the aging research field, and they continue to put everything they can into helping us get the resources we need in this exciting new area of research. As CEO of the Buck Institute, I'll tell you just a little bit about it. It was the first independent, nonprofit research institute dedicated to aging. We have 20 professors there who run independent research programs, and they focus either on the basic biology of aging or particular diseases of aging, for instance, cancer, Alzheimer's disease, diabetes, etc. And it's a very collaborative place. We have over 200 employees, many postdoctoral fellows doing research there. And the idea is to synergize efforts on basic biology of aging with people working on the diseases of aging to get new insights. Our goal is to extend health span, the healthy, functional, disease-free period of life. This report by the Alliance was compiled by a number of scientists. I was privileged to be involved in that process, and written by David Stipp, who's a wonderful writer. I think it really encapsulates not only where aging research has been the last few years, the great promise that's come from that research, where it can also go as well. There are many important directives in it, and many descriptions of vital experiments that have been performed recently. I will just highlight one of them. There now is a drug, a clinically approved drug, rapamycin, that you can give to a middle-aged mouse. The mouse lives 15% longer in response to this drug. It also has a 15% longer health span. So we already know that this concept is achievable in a mammalian animal model. I think it's reasonable to set a goal that we can extend health span similarly in humans in the not too distant future. If that were true, you would have on average 10 extra years of healthy life to have, and so you would in fact look like 60, and when you're 80 it would be the new 60. So I'm very excited to be involved in that. I think that this campaign is also vitally important. As you heard, the support for aging research is very limited, and yet it's the biggest risk factor for every chronic disease that you, or almost every chronic disease that you heard about today. And so we need to raise public awareness and help get the resources to make this promise come true. I think that that can be accomplished, and I'm very excited doing everything I can to contribute to that possibility. You know, I believe that geroscience is an important initiative. This NIH funded or supported initiative is a vital step forward for them. Dr. Hodes at NIA is really spearheading something that will involve other institutes, and I think do what the Buck Institute has been doing for a while, look at the interface between the basic biology of aging and the diseases of aging. And so I'm also very supportive of that. Geroscience, by the way, is something, the research was started at the Buck Institute. It was a roadmap funded grant from the NIH that we've been doing over 5 years at the Buck. There's been a great number of insights that have come from that. And so we're excited to see that term get outside of the state of California. So I don't want to take too much more time. I'm happy to answer questions about rapamycin or about any of the other research. I just want to reinforce my support for the Alliance and this program that's been produced. I think it's going to be vital as we look how to go forward with aging research, and the Buck Institute will be behind this initiative 100%. Thank you.
Thank you, Brian. I just draw your attention. Thank you very much, Dr. Kennedy, for making the trip to be here today, and to Mr. Frank Carter for providing us a real-life example of aging as the new 60. So what you can tell that this is not science fiction. It's real science, as we've heard from Dr. Kennedy, and it's not beyond the bounds of being possible for many, many more of our fellow human beings to live and age like Mr. Carter, and beyond that, to avoid conditions that now threaten him, from type 2 diabetes to some other conditions, all linked to the aging process. In your materials, you will see that the Alliance is joined by many other academic institutions, from the Einstein Medical College in New York to the University of Texas, other not-for-profit organizations, certainly the Buck Institute, and others, and they are all listed in your materials. I thank you all for staying following the hearing today, very important hearing on federal funding for medical research for the years ahead. Thank you all very much.